Hello and welcome to all our viewers in Nigeria and around the world to Health Guide on Global Television, your hub for topical discussions on health matters. I am Queen Agaba. Today, we dive into the critical topic of reproductive health and family planning. These areas are essential for empowering individuals and families to make informed choices about their health and future, from understanding conception options to addressing reproductive health challenges. We'll explore the strategies that can improve overall well-being and promote sustainable development. My guest on the program is Dr. Ejike Oji, who is a reproductive health expert and also the Chairman Management Committee Association for the Advancement of Family Planning. Many thanks for joining me on the program, sir.
Thank you, Queen. It's also my pleasure.
Thank you for being here. It's so good to have, a family health and reproductive expert here on the program. Can you help us make better sense of what reproductive health is all about?
Yeah, thank you so much for that question. A lot of people do not know that reproductive health has about 12 components. Number one is family planning. The second one is maternal health. And then, of course, when you say maternal health, you mean everything encompassing in the well-being of the woman. And then followed with that is the sexual health. And that sexual health also encompasses her ability to have compassion, enjoy with a sexual partner, and enjoy the experience. And then also we talk about infertility. What are the causes of an infertility? And then we can also talk about reproductive rights, the rights of the woman, especially if you are ill and they go to a hospital, you have a right to health and a right to have every aspect of reproductive health you're supposed to get. Also, we talk about menstrual health. Menstrual health is a major issue in terms of education of the young girl child. They might drop out of school because they don't have adequate menstrual health. We'll talk about also sexually transmitted infections, bacterial, viral, like HIV and others. And then you have also what we call reproductive tract infections, bacteria that will affect the possibility of a woman getting pregnant and all that. And then you speak about cancer too, the two major cancers in women, cancer of the cervix and then also cancer of the breasts. And then I think the final one in terms of that is also when you look at the issue of a woman that is not in tune with her environment, mental health, so to speak. So these are all the things that encompass reproductive health. And then when you say that a woman her reproductive health is the complete physical, mental, social well-being, and then reproductive health being too. That's when you say the woman is completely
So physical, social, mental,
and psychological.
And psychological. There are four then.
There are four, yes.
How to best describe it?
All of them.
Physical, mental, social, and psychological well-being of a person.
Of a particular woman, yes.
Of a woman.
Yes.
Oh, that's great to know. But why is this important for individuals?
Well, it's important in the sense that let's take for example, family planning. We that are reproductive health specialists say that family planning happens to be one magic bullet. If I would say it's the most strategic purchase you make in health. Why is this so? The reason is that for a woman that has proper family planning, that means you space your children and then you start making babies not before the age of 18. And I will explain all of that. And then you make sure you spread the one child to the other at least 2 years apart. And then also you do not have more than 4. And you do not start having your baby when you are getting to 40 years of age. Let me now explain all that. Let's say before the age of 18, a research carried out around 2004 by the Packard Foundation in Nigeria showed that almost 75 to 80% of women who die from pregnancy-related problems are below the age of 18. So for a child to get to the age of 18, age of maturity before she gets to start having babies, reduces her chance of dying. Also, it's been shown in a place like Nigeria too, a lot of women are slightly anemic, subclinical anemia, that's what we call it. And the way I will explain it is, if, for example, you have the level of blood of a woman should be about 11 grams, go to 12.
Okay.
So if you go into pregnancy, at that minimal level, you lose some blood during parturition, during delivery. So if within the next 1 or 2 years you have a baby and you do not recover that blood you lost due to malnutrition, not eating properly, eating diets that are not very balanced, what will happen is when you go to the next pregnancy, maybe you are going with 10 instead of 11. And then if you bleed, even though it's normal bleeding, it might threaten the life of the woman. Now, let's say it goes to the third pregnancy and it's quite rapid and the woman has not fully recovered. She's lost some blood also in the second pregnancy. So her hemoglobin level probably will go down to 8. So no matter how slight the bleeding will be, that will put that woman at risk of dying from postpartum hemorrhage. Now, let's talk about the fourth pregnancy. It's been shown that the fifth pregnancy of a woman might be more dangerous than all the other 4 pregnancies put together, because the constant use of the uterus will make it flabby and not contract after pregnancy, after baby is delivered. And then, of course, when a woman starts approaching 40 and starts having her first baby, a lot of complications can come in. So you can see how that plays in the woman's life. So you can see family planning is very important. Then the other ones, like when I described issues of cancer, it's been known that the 2 major cancers that kill women, cancer of the breast and cancer of the cervix, and all of them are all preventable, especially that of cancer. If they have screening at least once a year, when you're still young, maybe once in 2 years, but as you get older, once a year, you'll find out you have what we call precancerous lesions. And it will just take a small examination, and then once you see that precancerous lesions, you can burn it off. And that will prevent the woman having cancer. There are at least 2 or 3 prominent Nigerian ladies who died from cancer of the breast, of cervix, which is totally preventable. You get the point. And then let's talk about infertility. In a place like Nigeria, when a woman is married and she hasn't gotten a child, she has a lot of problems with occasionally her husband and her husband's relatives. So you can imagine the emotional pressure it will put on that woman. And then infertility, the commonest cause of infertility in Nigeria is complications of unsafe abortion. So you can see, because that will damage the tubes, and then the woman will not be able to produce eggs to have a baby. So you can see how all these things are all encompassing. And I did mention the girl child who is in school can drop out of school if she does not have the good menstrual hygiene package to be able to manage her menstrual cycle. So she might come to the hospital, to the school, and then, of course, with all the attendants, that will make her uncomfortable, and others might be wondering, what's going on here? And then because of that, she will drop out of school. And the consequence, the financial, the economic, and even the health consequence of a girl that is not educated when she eventually gets married. And then, of course, the fact that if a woman doesn't know her rights, if you show up in a hospital, and then even let's say you want to come to get family planning, the FP 2030 commitments, there are 2 major planks. One, it must be right-based. In other words, if you are going to get any family planning commodity or service, the nurse must counsel you and make sure what we call non-directional balanced counseling, so that you can take a family planning of your choice, not biased by the provider. So all of these are the things that, and then of course quality must be of high quality. So when you see all of this, that's how reproductive health is so key in a woman's life.
Okay, I'm going to come back to family planning, but let's talk about how individuals and even family can actively manage their reproductive health.
Yeah, if we talk about family planning, there are different methods of family planning. And then we also say family planning happens to be one of the health services or medical services that are so individualized. In other words, what is good for the goose might not be good for the gander. And that's why we talk about counseling. In family planning services, the most important component is the provider-client interaction. In fact, it's the number one quality of care, element. So what this means, if a woman comes, you look at her body type. If she's big, then you are not supposed to offer her hormonal methods. You need to explain to her, if you're already big, some of the hormonal methods can cause some additional, what we'll call retention of water. So you get bigger. And that might discourage the woman to continue. So what would you do? You have to look for other methods. And there are some major methods. One is barrier method, one is hormonal, okay? And then one is also surgical. When you say surgical, that means you do bilateral loop tube ligation. You cut the tubes, tie them, so the woman won't be able to produce eggs anymore. And for the man, you do vasectomy. You cut off the vas deferens where the sperm comes out to be able to make a woman pregnant. Now, the barrier method, of course, is condom mostly, and some use chemical too, put inside a woman's parts so that will prevent sperm having access to the woman's uterus. So when you look at all of this, it's important that the woman is counseled to be able to choose a method. Some people too, if they have what we call blood dyscrasias, in other words, their bloods can clot easily or that they can have excessive bleeding, it's not good to give them a hormonal method. So they rather choose a barrier method. So you put all those methods on the table. Each and every one of those methods, you tell the woman, these are the pros, these are the cons. These are the pros, these are the cons. It is that woman that will eventually make a decision what she will choose.
Okay, so it depends. You don't advise a woman, you don't tell a woman this is what you should choose. She should,
You have to tell the woman about all the options. And you have to tell the woman the pros and cons of each option. You get the point? And then with that, you tell the patient to make her final choice.
Oh, that's good. But let's look at the acceptance level. Because you obviously must have counseled quite a number of women, and what is it like? How aware are people of family planning? What's the acceptance level? What are those things they consider as stigma? Because I know that there's some people who would rather not do family planning because of the stigma around it or the misconceptions around family planning. What are those misconceptions? And please, can you help us demystify it, those myths?
Yes. Let's start by what's the acceptance level. Nigeria happens to have very low acceptance to family planning. We have, how it's designated is MCPR, that is modern methods contraceptive rate. In other words, for every 100 women, how many of them are using family planning methods? In Nigeria, it's just a dismal 12%. And that's why Nigeria signed a commitment in 2022 by the immediate past Minister, Hanire, FP 2030 commitment that says by the year 2030, Nigeria would have moved our family planning contraceptive rate from 12 to 27%.
Just 27?
Thank you, just 27. But you see that 27% will give us what we call the window period of transition from the demographic crisis we have now. We have a crisis in the country. All these killings, kidnapping is population driven. You get the point? That's the numero uno. And then if we get to that, because our fertility rate is still about 5.3, if we get to that contraceptive rate of 27, we will probably bring our fertility rate to 4, and that's the transition from crisis to transition to what we call dividend. Now, going back to your question as to what are the misconceptions. A study was done by Gates Foundation way back about, should I say 10, 15 years ago, which showed that in Nigeria, the major barrier to family planning uptake is myths and misconceptions about side effects. Somebody, remember what I said, it's good to counsel the woman and give the woman the one that is best for that woman. So if, for instance, you go and give a hormonal method to somebody that is already big, and she blows up after that, so she'll go around, this woman took her family plan, see how big she is. Nobody will know that it's because not appropriate counseling was done and given the correct method. And then they'll go and say something is happening. And then there is also this pill we call the morning after pill, the posting 2. When a lady would have had unprotected sex and takes it, what normally happens, it can affect your bleeding cycle. And then people will now go and say, hey, if you take it, you'll be infertile. That's nonsense. It doesn't happen like that. It happens to be one of the safest contraceptive methods. So it's myth and misconceptions of family planning that's making women not take family plan. However, what we'll call the unmet need, that unmet need means how many people out of 100 are saying, I need family planning, and they are not getting it. 19% of Nigerian women say, I want family planning, but I'm not getting it. So you see, it's on both sides. The acceptance rate is low. A lot of people that say, I don't want. But if you, on the average, if you look at how many women want family planning, 19%, their needs are not met.
You know, so when we talk about family planning, what comes to mind, first of all, is the women. And so we also think, like you rightly said, that there's family planning for men as well. But what is the acceptance level for men like? And do we begin to encourage more men to go into family planning? Because if you read some of the blogs around family planning, the discussions around family planning, most women want men to also engage in family planning.
Well, I can say there are 3 levels men can engage in family planning. One is to have a consensus with their partners, because that's where it starts. There are still a lot of, should I say, chauvinism in Nigeria. It's a patriarchal system. When tell the woman, jump, they don't want the woman to ask at all. Don't even ask how high can I jump, just jump, kind of. So it also happens in family planning. They don't have a conversation with their spouses or partners in terms of what will be the contribution of the man. So for the men, there are 4 major ways a man can also be part of family planning. One, which is not very well recommended because the failure rate is high, is withdrawal. When the man is having a relationship, sexual relationship, by the time she is going to have orgasm, he withdraws his male organ. So, but it's also been shown that even though the man has not ejaculated, some sperm cells can be deposited in the vagina and can cause pregnancy. So it's not a full recommendation. It's better than nothing at all. The second one is the barrier method. Everybody talks about using the condom. That's the one that is most popular with men. You know, the barrier method, so the sperm won't come out at all. So, and it has 2, should I say, 2 advantages. One, preventing pregnancy. The other one, preventing sexual transmitted diseases. Then the third one is vasectomy, which is very unpopular. That means cutting the man's vas deferens, which takes the spermatozoa from the testicles to the woman's vagina during sexual intercourse. Now, it might interest you in some of the studies that we have done. There's anecdotal evidence that the problem, the denial of doing that is not even the women, is the men. It's the women that say, no, man, they'll think it will make their men less of a man. But it doesn't really have any effects in the, should I say, sexual progress of the man. The only thing is that the man will be sterile. In some very remote instances, it can be reversed. So it's like a permanent thing. Then, of course, the last one is abstinence, which, you know, in inverted commas, it's difficult for people to abstain, both men and women.
Okay. We have to take a quick break now. When we return, we'll wrap up the conversation on reproductive health. Please stay with us. We'll be right back. Thanks for staying with us. If you've just joined us, this is Health Guide on Global Television, your #1 hub for health matters. And we have been speaking with Dr. Ejike Oji, who is a reproductive health expert. And before the break, we were talking about reproductive health. So how important, is access to family planning important to developing countries like Nigeria?
It's a very important question you have just put now. Remember what I said initially? A family planning services happens to be the most strategic purchase in health. And I will explain the multiplier effect it has. With family planning, I've already enunciated how it can save women's lives. Nigeria has one of the highest maternal mortality in the world, and it's linked to a high fertility rate.
Sad.
Nigeria is one of the poorest countries in the world. We have more multidimensionally poor people in Nigeria than any other country. India used to be #1. But India is 1.4 billion people. We're just about 200 and something million. Yet we have more people living in multidimensional poverty than India. Family planning will stop that. The reason why we're in trouble is our fertility rate is high, 5.3. So we have a youthful population. 75% of our population is under the age of 34. Now, those youth are largely unemployed, largely unemployable, and they desire what every other person desires in life. So when they don't get it, they feel so uncomfortable. So the first thing that happens, some of them start leaving the country. In 2006, I was invited by the Norwegian government to look at their strategies to intervene in Africa in terms of women's health and women's rights. When I sat down with the International Development Minister, the first question he put to me, Dr. Oji, how come every single day 13 commercial sex workers, 13 sex workers come into Norway from Nigeria? 2006.
Whoa.
As at that time too, the International Office of Migration said that for every 100 young Africans crossing the very dangerous Mediterranean Sea to Europe from Africa, 14 of them were Nigerians. If we had any doubts, when the last President Buhari came into power, in the first 6 months of his reign, he brought back 20,000 Nigerians from Libya who were stranded trying to cross over. So you can see that our young ones are trying to leave. Now, there are two types of immigration. One is global, what we call global citizens. When well-trained doctors, engineers, IT people start leaving the country, that's global citizens that can get jobs elsewhere. And it's happening in Nigeria right now. It's been happening since the 2000s. As we speak, some banks are having problems with their IT. The reason is that most of their IT staff are left the country. I have a nephew who used to be the head of IT in one of the banks. He left about 4 years ago to Canada. What does that mean? That means the functions he was doing at that time has gone down to somebody who is less skilled than him. And that's why some of the banks are having problems. You say no network, no network. Those are the reasons. If you come to the healthcare sector, the Jabba syndrome has hit the healthcare sector in such a way that is unimaginable. And that's why somebody like me, I don't want to dwell on the problems. Like myself and my colleague, we've just developed a digital health platform called Glow Smart Health, working with Glow for people to be able to consult doctors even from outside the country to improve the penetration of people having access to health.
Oh, well, that's great.
Yes, so those are the proactive things that are going on. We're going to be launching it soon with Glow. Then the other thing that happens is that family planning is linked to the economic prosperity of a country. Let me give you two major examples. People say we need a large population. India, China, 50 years ago, they were the poorest countries in the world. As we speak, China is the second largest economy in the world. India is the third largest economy in the world. What did they do differently? They reduced their fertility rates to China, 1 per couple, India, 2 per couple. But they didn't just stop at that. There are 4 other deliberate steps they took to change their burgeoning population to prosperity. They improved healthcare, especially for women. They improved education, accessible and then affordable and relevant education for the young people, so they were able to get us high. The fourth one, the government introduced ease of doing business so that they can get venture capital, they can have access to markets, and they can start earning income. So their income per capita will increase and their GDP. And finally, they make sure their country is a country of equity, fairness, where strategically merit drives leadership. Unlike in our country, where anybody can be anybody, you can put a fool in a leadership position at every level, and that's why the country is going into whatever you think it can be. And that's why the poverty level in the country is so high. So population dynamics, the only thing that can make you achieve your aim is through family planning services.
Thank you so much, Dr. Ejike Oji. I wish we can really extend this conversation, but we'll definitely have you back here to, talk more on reproductive health, particularly here in Nigeria. Well, that's where we draw the curtains on Health Guides today. Do make sure to join us same time here on Global Television. And follow us across all social media platforms using @GlobalTVNG and other handles now showing on your screen. I'm Queen Agaba. Thank you for watching and see you again.